Sir, a basic question which has been coming every time in each and every session from all the warriors is one, does every ankylosing spondylitis warrior require a biologic? And second, when exactly does a rheumatologist start thinking in terms of a biologic for a warrior? Please.
Now, basically, my experience is about 35 years in rheumatology. Like what Dr. Shashank said, 35 years ago, when I saw a patient with ankylosing spondylitis, he came to me absolutely crippled, bent. Nothing could be done for him because people were not aware of the disease, medications were not available. What we could do is to only make a diagnosis and say we cannot do anything. Now, thanks to people like Shashank, there is a greater awareness of the disease. People are coming earlier to the rheumatologist for treatment. Now, there are two important components of ankylosing spondylitis. You have the peripheral joint problem, and then you have the spinal problem. What we call peripheral arthritis. The wrist, the elbows, the knees, the ankles, and the smaller joints of the feet can be swollen. 25% of patients with ankylosing spondylitis have peripheral joint involvement. The predominant problem in ankylosing spondylitis is the spine involvement. Like what he said, cytokines, Burra messengers, they go and they cause destruction of the joint and it gets fused as if people are putting it in cement. So they develop a bamboo spine, they can't move forward, they can't move backward, the hips can get affected, may require joint replacement, they may not be able to walk. So in ankylosing spondylitis, you have what is called a spinal portion and a peripheral portion. You would have told earlier, we give NSAIDs, non-steroidal anti-inflammatory drugs, painkillers to decrease the pain and inflammation, but we cannot give it for a long period of time. In India, we are permissible to about 3 to 6 months. Abroad, they usually don't go beyond 4 weeks. Because of economic constraints, we give the NSAIDs for a longer period of time, and we follow regularly the kidney function, and we also follow the blood count. But non-steroidal anti-inflammatory drugs do not have any basic effect on the disease process also. So, sir would have told earlier, we have some DMRDs like sulfasalazine and methotrexate. But let me make a point very clear. 35 years ago, I gave only methotrexate and sulfasalazine to all patients with ankylosing spondylitis, whether they have spine involvement or whether they had peripheral joint involvement. I'm sorry, knowledge was not available then. There was no research. Now, scientific research has clearly proved that the sulfasalazine is useful only in the peripheral joint problem. And the only drug which can act on the spine is biologics. Remember that very important point. Sulfasalazine does not have any effect on the spine. Even if it has got a marginal effect. But the drug of choice for treating ankylosing spondylitis when they have predominant spine involvement is biologics. But SAR told biologics are definitely a little costly. So taking the psychosocial constraints into consideration, in India, we also give sulfasalazine to people for spine involvement when they cannot afford biologics. Very important. It doesn't mean everybody should take biologics. You would have seen something called the French Revolution. There is no bread to eat. The Queen said, if there is no bread, eat cake. So we are basically not a very rich country, but I can tell you one thing. All the other countries, thanks to COVID, are worse off than you and me. Insurance gives biologics abroad in US and UK. Now it is not available. India, like what Dr. Shashank said, thanks to biologics which are very cheap, 50% of the original molecule, biologics are available in India. And I have been using biologics from 2000, from the day the biologic was born. So, one thing I like to tell you clearly, peripheral arthritis will respond disease modifying only to sulfasalazine. Methotrexate is not that useful. Spinal involvement, your sulfasalazine will not have any effect. So any person with predominant spinal involvement, without any response to anti-inflammatory drug given over 3 months, you have to start them on a biologic. The second important point is you have to diagnose early and find whether the disease is active. Severe pain in the night, severe pain early morning, low back pain, not regular morning stiffness going for 1.5 hours, not able to walk. We do only one test called C-reactive protein. C-reactive protein will tell you whether the disease is very active or not. It is an indication to start biologics. So one important thing which I would like to tell you, biologics are the drugs of choice at present today in the treatment of ankylosing spondylitis. And I sincerely apologize to all the ankylosing spondylitis patients I saw 20 years before. That time I did not have biologics and I was giving you only with sulfasalazine. I am 67 years old. I may not live long to see better drugs available. But Shashank is very, very lucky. He's quite young. He will definitely see more biological drugs available in the market. And one thing all of us should accept, ankylosing spondylitis is not curable. It is only controllable. Definitely one day, I don't know whether I'll go to heaven or hell. Wherever I go, I'll be very happy that scientists will find a miraculous drug to treat ankylosing spondylitis and cure it. So one small point, biologics indicated in the presence of spinal disease, indicated in the presence of active spinal disease, no response to painkillers, biologics are the drugs of choice. Fortunately, India has got biosimilars. Nobody need to go abroad for treatment for ankylosing spondylitis. We are better off on Indian soil. They are more economical, easily available, and also available in the rural areas. And very important, it's not a disease anymore of the rich man. Even people can afford a biologic. So don't get worried. They are wonderful drugs.